Hi, welcome to today's webinar presented by the Governor's Office for Children. This webinar is going to cover the Home Visiting Accountability Act of 2012 and the reporting for state-funded programs that was mandated through this legislation. This is Jennifer Bistrak. I'm the Health Policy and Program Analyst for Home Visiting located in the Governor's Office for Children. There are two goals for today's webinar, and I expect the webinar is going to take about an hour. The first goal is to present you with information on the purpose for this data collection, including the legislation from 2012. And the second goal is to discuss the actual data collection process. As we go through, if you have any questions, my contact information is at the end of this session, and feel free to call or email me with any questions. Okay, so first to go into the legislation from 2012. This Home Visiting Accountability Act included new requirements for all programs that are funded through state funds or with funding passed through the state. So if you get federal funds that are passed through the Department of Health and Mental Hygiene or federal funds that are passed through MSDE, you are included in this as well. So the state legislature determined that this new legislation would require that all programs, or at least 75% of the programs receiving the funds, needed to be evidence-based, with the other 25% being promising practices. So right now, 100% of the programs that are sponsored through state funds, or I believe almost 100%, are evidence-based practices. So not only did this legislation determine the evidence-based or promising practice quality, but this legislation also requires that these programs must submit regular reports that account for expended funds, that identify the number and demographic characteristics of the families served, and note the outcomes achieved by the home visiting programs. And the Governor's Office for Children is required to report to the governor and the state legislature at regular intervals. So we began embarking on standard measures that could be gathered from all of the funded home visiting programs across the state. This process began almost immediately after the legislation began. So the Children's Cabinet, the Governor's Office, convened a work group toward this end. Was convened on behalf of the Children's Cabinet and was comprised of members of Department of Health and Mental Hygiene, MSDE, the Department of Disabilities, Johns Hopkins University, the Maryland Family Network, the Family League, and home visiting program representatives from Baltimore City and from several counties. So there was a lot of input in this process of first determining the standard measures and then determining how we were going to collect standard measures across the state. Technical assistance was also provided by Kay Johnson, who's a national expert on state home visiting policy, systems, and administration. She is with the Pew Home Visiting Campaign with the Pew Charitable Trusts, and she provided invaluable technical assistance in helping the work group to prioritize which standard measures should be recommended to the Children's Cabinet, which standard measures would prove to be the most effective in reporting to our state legislature. So the work group comprised of the stakeholders mentioned before. They got together, determined what programs were already measuring, and made recommendations to the Children's Cabinet on what common measures will best address monitoring and effectiveness of home visiting programs. The Children's Cabinet adopted these standard measures just this past March. And these are the standard measures that were adopted. You'll see that the domains represented include child health, maternal mental health, typical child development, children's special needs, and parent-child relationships, and also just relationships within the family. So from these standard measures, the next steps included the development of a data dictionary, which was performed by the Institute for Innovation and Implementation at the University of Maryland School of Social Work. From their work with the development of a data dictionary, the work group reconvened and considered that a survey process would be the best way to collect raw data from the evidence-based home visiting programs in order to put together a report that would represent the 60-plus programs that are conducted throughout the state of Maryland right now. The final survey tool was finalized November of 2012. It actually, after our first webinar, the survey tool was adjusted to reflect some of the questions that came in from the attendees of that first webinar. And the survey that we'll go through today represents a lot of hard work put in from the work group and questions that were altered due to feedback from our first webinar. The implementation for the trial run of this initial data collection process will begin in February of 2015, or actually it will begin as soon as your second quarter ends, the second quarter of the fiscal year. So if you look at the bolded bullet here, data submission for this first trial run of data collection across the state is due on February 6, 2015 for the reporting period of July 1st through December 31st. So your first and second quarters of fiscal year 15. So we were thinking that you'd have some time to come back from the holiday, get settled in, and then attack this data collection process. But in the meantime, you could take a look at the data collection tool and start to organize your thoughts. Technical assistance is available to health departments, to the local vendors, to the local management board, as needed. So just give me a call or send me emails and we can determine the best form of technical assistance for you. So we have partnered with MSDE in order to host these webinars to get information out as succinctly as possible and hopefully make this process as smooth as possible. And as I mentioned, you can give me a call at any time for more hands-on technical assistance, and we will be reviewing what we've learned from this process and giving you some updates at the Home Visiting Conference this spring. I don't have a date for that conference yet, but information should go out soon about that. This is contact information for various folks involved in this effort. You see contact information for Kim Allott with the Governor's Office for Children, Mary Lacoste with the Department of Health and Mental Hygiene. My contact information is right here. And if you work with MSDE, your point of contact is Nancy Barobi. So you can contact any one of us, as we've all been, we're all deeply rooted in this process. We do have materials up on the Governor's Office for Children website. So if you want to write this website down, www.goc.maryland.gov/initiatives. This link brings you to all the initiatives that the Governor's Office for Children is involved with. And if you scroll down, you will see, let's see if I can go there right now. If you scroll down, let's go from here, from current slide. You will see under home visiting that currently we have, so here's the home visiting section. Currently you can get, this is a link to the hard copy of the data collection tool. This is a link to the PowerPoint presentation that you're watching right now. And this is a link to frequently asked questions about the data collection process and about the data collection tool. These are questions that came up during our first webinar. Okay, so I am going to take us now to the data collection tool, where we can start taking a look at the actual data tool. You You will have access to this survey methods tool sometime in early January. In the meantime, there's a hard copy located on the website, on the Governor's Office for Children website, and I think the best way to attack this is to use the hard copy of the tool, and once you have all your data collected, to open up the link and go ahead and start to input your data once you have it all in front of you, because all of these questions are mandatory, so you won't be able to move from section to section before answering the questions. So I apologize in advance. I am going to go through this survey question by question just to make sure that the language is clear and just to make sure that we're doing as thorough a job as possible in preparing you for this data collection process. Okay, starting with question number 1, you're asked to indicate your jurisdiction. We ask that you, if you have a multi-county program, that you fill out a different form for each county. So you would have to separate your data county by county so that we can report that in the most thorough way possible up to the state legislature, and so that our legislators can take a look at what's going on in their county specifically. So, for example, if you are on the Eastern Shore and you're Kent County, you would select Kent. If you're Queen Anne's County, you'd select Queen Anne's, even though your program has a lot of ties. Please let us know the best person to contact regarding this data. So as we're reviewing your data and compiling the state data, who should we contact if we have any questions? It might be you as the program director, it might be your data entry person. Just let us know that best person. And question number 3, please select the evidence-based home visiting model for which this data is being provided. So if you're a local management board and you operate several of these, or if you're a health department and you operate several of these models, you would need to fill out a different survey for each model that you operate. So you'll only be able to select one. Okay. The next couple questions refer to the sources of funding. Please indicate the percentage of funds that this program receives from each type of agency. And this question is set up so that you won't be able to move on until your total equals 100%. Moving on, question number 5, we're looking at federal sources. So if your home visiting is funded through a federal source, it might even be passed through the state. So you might be, if you're McVie funded, for example, you're receiving money from the federal government. It's not state money, but it is passed through the state, so you would just indicate that here. So just indicate what your sources of federal funds are. In question number 6, you're indicating your sources of state funds. And again, if you don't receive any state funds, you would just click not applicable. Right now, this survey is letting me go through without answering each question, but when it goes live, it will be mandatory that you answer each question. In number 7, please list all sources of funding for this program that were conducted, that were counted as nonprofit or other. So you would list those here. Okay, so now we're going into specific demographic information about the families and children and mothers enrolled in your program. So just note that we are collecting aggregated data. We're not collecting data on a person-by-person level. So this is cumulative across your program. In question number 8, we're asking the total capacity of your program during this reporting period, and this reporting period is July 1st through December 31st. Total capacity is defined as the maximum number of families that your program is funded to serve. In number 9, the question is in regards to weighted capacity of your program during this reported period. And weighted capacity is defined as the maximum number of families the program can serve based on the level of clients and the frequency of their home visit. So we understand if you have all new clients, that your level of service to them will be higher than if you have clients who have been with your program for a year or two. And there are questions about capacity in our frequently asked questions document as well. It was brought up that weighted capacity can alter from 1 month to the next, and so we ask that you report weighted capacity as of the last day of the reporting period. Question number 10, what is the total number of women served by this program during the reporting period? So this is going to be only the mothers and expectant mothers. There is a section later for primary caregivers who are other than mom. So save any information you have about primary caregivers other than mom for the next section. Question number 11 is asking about the age range of mothers and expectant mothers. So you'll see that you have an area for mothers and an area for expectant mothers. So you would just indicate how many mothers you have who are under 15 and how many expectant mothers you have who are under 15. How many mothers you have who are 15 to 17, how many expectant mothers you have who are 15 to 17, and so on and so forth. Number 12 is a race and ethnicity question. So we created questions 11 and 12 about age ranges and race and ethnicity to mimic Maryland vital statistics. So question number 12 breaks down your choices into white, non-Hispanic, black, non-Hispanic, American Indian or Alaskan Native, Asian or Pacific Islander, multiracial, not Hispanic, multiracial and Hispanic, and then you have choices that include Hispanic, and your last choice is not specified. It was brought to our attention in question number 12 that some of your families may report only as Hispanic and not specified race, so you'll see that that category has been added here. Hispanic, Latino, or Spanish, and unspecified race. So then when you move to the next section, we're asking similar questions in regards to the target children who are enrolled in your program. So question number 13, what is the total number of target children who are served by your program during this reporting period? So this is all target children who were served during the reporting period, not just the ones who were enrolled during your reporting period. Question number 14 asks the age ranges of these children. You have 3 options here: under 12 months, 12 months to 35 months, and 36 months to 60 months old. So your number in 14 should match your number in 13. So this total should match your answer here. And then number 15 is a race and ethnicity question for the enrolled child, the target child. Okay, so in this section we ask about information on primary caregivers who are other than mom. It came to our attention during the work group development of the survey and also during our first webinar that programs are serving the primary caregiver is sometimes not mom, but the program is still being delivered at least in some portion to that primary caregiver. So in question number 16 we ask you to tell us how many of the following were enrolled as the primary caregiver to the target child during this reporting period. So you have some options laid out here, and then there's a section for other, if it's somebody other than these options. In question number 17, we're interested in knowing how you provide services to this primary caregiver. Do you provide services per the model and curriculum? Do you adapt the services? And do you provide something other than the services that you would provide to mom? In number 18, we ask you to let us know anything additional regarding your providing the services to primary caregivers other than mom. Okay. Moving on to the next section, and now at this point we're really starting to get into the standard measures. So we're starting to get into the domains excuse me, and the specific measures that were adopted by the Children's Cabinet. So in the first standard measure, we're taking a look at child health, and there's one question regarding child health. This question is, what is the number of target children who have fully adhered to the Well Child Checkup schedule recommended by the American Academy of Pediatrics while they have been enrolled in this program? So the AAP's Well Child Checkup schedule is listed, and we ask you to let us know how many of the target children adhered to this schedule. Remember that you're not required to look back prior to their enrollment in your program. And a great question came up during our first webinar. What if they missed the first month, but they've been on the right trajectory for the last 3 visits? That child would be counted as adhering to the Well Child Checkup schedule because they got on board and now they're on board. But if they're haphazard, if they went to their 1 month and now they've gone to their 4 months and they missed their 6th month, that would be more haphazard, so that would not count in this question. If you don't collect this information, you'll see that you can put a DNC here for do not collect. And then we ask in number 20, you let us know why you're not collecting, and you could just put not currently required to collect, and maybe you would need to develop a collection process. So let us know what technical assistance you would need in order to start collecting this data for next time. All right, we're moving on to the next standard measure here, and this category is information on maternal mental health. So in this category, the first question that you see is in regards to depression. Please complete this chart with data on depressive symptoms for the expectant postpartum mothers served in this program during the reporting period. Only count each woman once, even if multiple screenings were performed. Count a woman as screened positive for depression if she's screened positive at any point during the reporting period. And for any of these measures, if your program currently does not collect this data, place an X in the appropriate column. So you will see a section here for do not collect. So when we go down, the first question here is, what is the number of women screened for depression? So you would write the number of women here. So maybe you screened 25 women for depression. What is the number of women who screened positive for depression? So maybe 10 of your current clients screened positive for depression during this reporting period. What is the number of women who screened positive who were then referred to services? So maybe you referred all 10 of those women to services. What is the number of women who either initiated mental health services or continued mental health services? So maybe your program collects the previous 3, but maybe your program currently doesn't collect information on women who are receiving services currently. So you would put an X there. So if there's anything within this question that you don't collect, put an X. But for the pieces that you do collect, please indicate the number here. I do want to make a note about this last piece, the number of women who either initiated mental health services or continued services. We're interested in knowing during this reporting period basically how many women were receiving mental health services. So these women may have initiated services at some other point. They may have even been enrolled into your program receiving services. But we do want to know during this reporting period all of the women who are receiving services regardless of when they initiated. In number 22, we ask that you do the same thing as you did for the well child checkups. If you don't currently collect some of the data, please indicate why you don't collect that data and what technical assistance you would need to begin collecting that data. When we look at number 23 and 24, These questions are basically identical to the questions you just saw for depression, and these questions are in regard to substance use and substance abuse, and this includes alcohol and tobacco. Please use this chart to fill in data regarding substance use and abuse for the expectant and postpartum mothers. Only count each woman once, even if multiple screenings were performed, and count a woman as screened positive if she's screened positive at any point during this reporting period. And again, if you don't collect any of this data, please put an X in the appropriate column. So for the first, what is the number of women who you screened for substance use and abuse? The second part, the number of women who screened positive for use and abuse. The third part, the number of women who screened positive who were then referred for services, and the number of women who either initiated substance use abuse services or continued services during this reporting period. And in number 25, you would indicate any reasons that you don't collect data and what technical assistance you would need to begin. In the next question, in the next couple questions, we're looking at clinically high parenting stress. This is another one of our standard measures under maternal mental health. This is the last measure under this domain. Please fill in the following chart with information regarding clinically high parenting stress. Fill in only the column for the tool that you use in your program. If the program doesn't currently collect this data, place an X in the appropriate column. Please count each woman only once, even if multiple screenings were administered with the same client. Also, please count a mother as presenting with high parenting stress if she screened positive at any point during this reporting period. So the responses options to this question are a little different than our previous two questions because there are so many different tools that you could have used. So we ask you to let us know what tools you're using so we can get an idea of what everybody's using out there. So if you use the Parenting Stress Index tool, you would put your total number here. If you use the Healthy Families Parenting Inventory tool, you would place your number here. So again, what is the number of women presenting with high parenting stress? That's the number that you're putting in here. If you use the Life Skills Progression tool, you would put your responses here. And if you use any other tool, you would place your responses here. And you would let us know what that tool was here. And if you don't currently collect this data, you would respond here with an X. And then in question number 27, you would indicate what technical assistance you would need to start collecting this information. Okay, so we've got 2 of our 5 domains done. We're moving on to the third domain, which is information on child development. So in this section, we break questions down using the ASQ3 tool and the ASQ SE tool. All right, let's dig in here. In question number 28, what is the total number of children who were screened for typical development of communication, gross and fine motor, problem solving, and personal social skills via the ASQ3 tool during this reporting period? Children should only be counted once, again, even if multiple screenings were performed. So what's that total number of children who were screened? In question number 29, we get at more specifics about what you discovered when you screened with that ASQ3 tool. So what is, before I go into the specifics, we're looking at results from the child's most recent screening. So maybe they've been screened several times during this reporting period, and we're interested in results from the most recent screening. What is the number who demonstrated atypical development as evidenced by a score below the cutoff on the ASQ3? What is the number who demonstrated atypical development and were referred for further services? And what is the number who are currently receiving further services? In question number 30, we go through the same series of questions in regards to the ASQ SE tool. So you would put that total number there of how many children were screened using the ASQ SE tool. And then you would answer those follow-up questions. The number who demonstrated atypical development as evidenced by a score above the cutoff for the ASQ SE. The number who demonstrated atypical development and were then referred for further services. And then the number who are currently receiving further services for atypical development. And number 32, this is where you would give us input if you don't currently receive, don't currently use ASQ or ASQ SE to measure atypical development. Okay. We are now in the domain of children's special needs, so domain number 4. Please fill in the chart with data on children referred to or receiving the following services for disabilities during the reporting period. So IEP and IFSP are defined here because those are used down here. So we're interested in knowing the number of children referred to the local school system child find office for Part B preschool special education services, the number of children referred to the local infants and toddlers program for Part C early intervention services, the number of children receiving Part B, and then the number of children receiving Part C. And then the last option is the number of children receiving private services for disabilities. So we've got referred to public services in the first two, receiving public services in the second two, and receiving private services in the last. Okay, so good news, we are now on the last domain, which is relationships, and we're in the home stretch of the data collection tool. Question number 34, what is the total number of mothers assessed for parenting behaviors, and you might also refer to them as parent-child relationships, at some point during this reporting period? Actually, this question is a little more, this question is a little different, so let me back up. What is the total number of mothers assessed for parenting behaviors and or parent-child relationships at some initial baseline point? It may not have been during this reporting period. Sorry for that confusion. So we're getting at looking at moms who were assessed at a baseline point and reassessed and how they're doing, if their parent-child relationships and parenting behaviors have improved. So in 33, what is the total number of mothers who were assessed at some baseline point? And an example of a tool that you may have used for this is the home inventory or the Healthy Families Parenting Inventory. In question number 35, we're referring specifically to this reporting period. So during this reporting period, how many women who had that initial baseline screening were also screened for a follow-up measure during this reporting period? So maybe you have done a baseline screening for everyone at enrollment. So maybe you have 25 women here, and maybe you have conducted a follow-up screening for 12. So then it becomes these 12 women who we're interested in number 36. How many mothers who were assessed at both baseline and follow-up showed an improvement in their parenting behaviors or parent-child relationships? So you would indicate that number here of women who improved. In number 37, you indicate any reasons you don't currently collect this data and what technical assistance you would need to begin collecting. Okay. The next couple questions refer to intimate partner violence, or in your data system you may have it recorded as domestic violence. So we wanted to represent both possible ways that you may have this measure represented. So in number 38, please indicate all times at which home visiting staff screens moms for intimate partner violence or domestic violence. So you can put as many check marks as you currently perform here. So what are the different intervals that you conduct intimate partner violence screening? And if there's something, if you check other, let us know what that interval is. Okay, in question number 39, we're getting at the number of women who are indicated in each one of these questions. So the first part, what is the number who were screened at 36 weeks gestation? What is the number who screened positive by 36 weeks gestation? And of those women who screened positive by 36 weeks of gestation, how many completed a safety plan within 24 hours? So these first three questions are all in regards to women who were screened by 36 weeks of gestation. So if you run a program where you enroll women after their prenatal period, then these questions are null to you. So you would put an XXX because you may not have women, you may not serve women who are prenatal. So the next set of three questions are in regards to women who are screened at any other interval. So what is the number of women who are screened for intimate partner violence at any other interval other than by 36 weeks gestation? What is the number of those women who screened positive? And what is the number who screened positive and completed a safety plan within 24 hours? And in number 40, you would indicate any reason that you don't collect this data and what technical assistance you would need. And this concludes your data submissions. You would just click submit. So you have a hard copy of this data collection tool that's on the Governor's Office for Children website. And I know I mentioned this at the beginning, but the best bet would just be to print out this hard copy. And you might even, if you represent a local management board or the health department and you have vendors, you may ask that your vendors collect this information and submit it to you. And you may want to submit all your vendors at once through one form, or you can have your vendors submit individually. So maybe your county has 2 or 3 different vendors who run a Healthy Families program, and you may ask them to submit the information on their own. How you submit is up to you. So that's a discussion that if you have any questions about, you can call me and we can figure out the best way to submit together, or you can discuss this with your vendors and determine the best way that you want to submit. But we leave that in your hands. One other piece of information I'm going to add to the Governor's Office for Children website is we have a qualitative data collection tool. So recognizing that quantitative information is not the only way to communicate a story, it often needs some life breathed into it. You will see up on the Governor's Office for Children website a qualitative form to fill out if you have a story to tell about a family that jumps into your head as really benefiting from your service that you think our legislators need to hear about. We will include that in our report in some form. So that will be available to you on the Governor's Office for Children website. It is not mandatory, but we ask if you have a compelling story. It doesn't need to be a vignette that you put together. It can just be a brief paragraph letting us know how the home visiting program impacted this child, this mother, this family, to help us better tell our story. So that's the end of this webinar. I really appreciate your attention. This This data collection process is going to help us to communicate the value of home visiting across Maryland through a collective lens and to provide a very thorough report to our governor and state legislature. Thank you very much. I look forward to answering any questions or providing any technical assistance that you could possibly need to have a smooth data reporting process. Thank you very much.